There are several, but let's take an example that's borrowed to the group of disease that we most frequently encounter, which are the nodal-based lymphomas. I think there's still a gray zone between the group of follicular helper T cell lymphoma and what we call by default, not otherwise specified. The reason being that we have guidelines, we have criteria to define what is a TFH phenotype, but it's also widely acknowledged that probably our definition is currently insufficient and may capture cases that probably are not biologically related to the group of TFH lymphoma. So we need to come up where to draw the line and how to best define TFH lymphoma in order to keep up with a group that's biologically meaningful.